Have you ever wondered why you might be urinating more at night? Welcome to our deep dive into the world of nocturia, a condition characterized by increased urination during the night. This phenomenon is more than just a nightly nuisance. It is influenced by a complex interplay of physiological and medical factors, ranging from hormonal influences to age-related changes and even certain medical conditions. Nocturia is a multifaceted issue. Let's dive in and explore these reasons one by one. Firstly, let's talk about physiological reasons. One key player is the hormone antidiuretic hormone, or ADH, produced by the pituitary gland in our brain. This hormone is like a conservationist, helping our kidneys to save water by reabsorbing it from the urine back into our bloodstream. Generally, ADH levels peak at night when our bodies are at rest. But if for some reason ADH levels don't rise as they should, or the kidneys don't respond to it properly, we end up with more urine production at night. Now, our body's natural sleep-wake cycle, also known as the circadian rhythm, also has a role in nocturia. This rhythm regulates the production of ADH. When we're awake during the day, ADH levels are naturally lower, leading to higher urine production. At night, as we sleep, ADH levels rise and urine production decreases. But if our circadian rhythm gets disrupted, we might face issues with ADH production and nocturia. Throughout the day, our body's fluid balance shifts. We naturally consume and excrete more fluids during our waking hours. This diurnal variation can lead to more urine production during the night as our body continues to process excess fluids. Our body's internal clock, guided by circadian rhythms, influences urine production. Hormonal changes, such as the increased production of ADH at night, can affect urine concentration and volume. Our bladder's capacity and sensitivity to filling can also influence nocturia. Some of us may have a smaller bladder capacity or heightened bladder sensitivity, leading to more frequent urination, especially at night. As we age, nocturia becomes more common due to changes in bladder function, a decreased ability to concentrate urine, increased urine production at night, and conditions like benign prostatic hyperplasia in men or pelvic organ prolapse in women. So these physiological factors can significantly contribute to nocturia, but what about medical reasons? Now it's time to delve into the medical reasons behind increased nighttime urination. Firstly, let's consider the impact of fluid intake before bed. Consuming large amounts of fluids, particularly diuretic beverages like coffee, tea, or alcohol close to bedtime can increase urine production, leading to nocturia. It's a simple cause and effect that can often be overlooked. Moving on, a variety of medical conditions can contribute to increased nighttime urine production. One such condition is diabetes. Uncontrolled diabetes can lead to increased urine output due to high blood sugar levels and the kidneys attempt to eliminate excess glucose. This means that the body is working overtime to regulate blood sugar, often resulting in nocturia. Heart disease, particularly congestive heart failure, is another potential cause. This condition can lead to fluid retention during the day, which in turn can cause fluid shifts and increased urine output at night. It's a domino effect that starts with the heart, but ends up affecting your sleep patterns. Urinary tract infections, or UTIs, can also lead to increased nighttime urination. These infections can irritate the bladder, increasing urinary frequency, including at night. And let's not forget about prostate issues. An enlarged prostate in men can obstruct urinary flow, leading to incomplete bladder emptying and nocturia. Lastly, let's discuss bladder disorders. Conditions like overactive bladder syndrome, bladder inflammation, bladder tumors, or neurological conditions affecting bladder control can all cause nocturia. These disorders directly affect the bladder's capacity to hold urine, often leading to increased urination, especially at night. In all these cases, the body's attempt to maintain balance and eliminate waste can end up disrupting your sleep. So it's crucial to understand these potential causes and seek medical advice if you're experiencing nocturia. Indeed, a variety of medical conditions can increase nighttime urine production. Let's continue our exploration into the medical reasons behind nocturia by focusing on some other factors and conditions that can lead to increased nighttime urination. First on the list is kidney disorders. Conditions like chronic kidney disease, kidney stones, or electrolyte imbalances can all affect the kidney's ability to produce and excrete urine, potentially leading to nocturia. Next, we have sleep apnea. If you've ever heard of obstructive sleep apnea or OSA, you might be surprised to know that it's associated with nocturia. Disrupted sleep patterns, hormonal changes, and increased urine production during awakening periods can all contribute to increased nighttime urination in individuals with this condition. We also need to consider the role of medications. Certain drugs, particularly diuretics, encourage urination. If these are taken close to bedtime, they may contribute to nocturia by increasing urine production. Finally, let's turn our attention to pregnancy and childbirth. Women in particular may experience frequent urination due to weakened bladder and pelvic floor muscles resulting from these life events. These factors, along with those we discussed earlier, can all contribute to nocturia. It emphasizes the importance of understanding your body, your health status, and the potential influences on your sleep patterns. Stay tuned as we summarize what we've learned and discuss how to manage nocturia. So in conclusion, nocturia, or the prevalence of excessive nighttime urination, is a condition impacted by a wide array of factors. On the physiological side, elements such as the ADH hormone, our sleep and circadian rhythms, the diurnal change in fluid balance, the capacity of our bladder, and changes tied to aging can all have an effect. Alternatively, from a medical perspective, factors such as bedtime fluid consumption, conditions like diabetes, heart disease, urinary tract infections, prostate issues, and bladder disorders are also significant contributors. Additional factors to consider include kidney disorders, sleep apnea, specific medications, and pregnancy and childbirth. Comprehending these aspects is crucial for managing and potentially minimizing your nocturnal to the bathroom. Remember, always seek advice from a healthcare professional if you're confronting nocturia. Moving on to the management and treatment of nocturia. One of the most straightforward ways to manage nocturia is through fluid management. This involves limiting fluid intake, particularly diuretic beverages such as coffee, tea, or alcohol, in the few hours leading up to bedtime. This simple change can reduce nighttime urine production and, in turn, alleviate nocturia. Another crucial aspect of managing nocturia is medication adjustment. Certain medications, such as diuretics or antihypertensives, can contribute to nocturia. If this is the case, adjusting the dosage timings or even the type of medication under the supervision of a healthcare professional may be beneficial. Remember, these are just some of the ways to manage nocturia. Always consult your healthcare provider for a treatment plan tailored to your specific needs and conditions. In the next section, we'll discuss some lifestyle changes that can also help manage and potentially minimize your nocturnal visits to the bathroom. Let's move on to discuss how addressing underlying medical conditions and making lifestyle modifications can help manage and potentially minimize your nocturnal visits to the bathroom. If you're suffering from nocturia, it's possible that an underlying medical condition such as diabetes, heart disease, urinary tract infections, prostate issues, or bladder disorders may be contributing to your symptoms. By treating these conditions, you can help manage your nocturia. But it's not all about medication and medical treatments. Lifestyle modifications also play a crucial role in managing nocturia. Improving your sleep hygiene, maintaining a healthy weight, managing stress, practicing bladder training techniques, and avoiding caffeine and alcohol close to bedtime can all help reduce the frequency of nocturnal urination. Remember, these strategies can be very effective, but it's important to consult with a healthcare professional for a personalized plan. Everyone is unique, and what works for one person may not work for another. In the next section, we will wrap up our discussion on nocturia. Stay tuned. Lastly, let's talk about the importance of medical evaluation in managing nocturia. If you're someone who's been experiencing persistent or bothersome nocturia, it's recommended that you undergo a thorough medical evaluation. This isn't just a routine checkup. This evaluation is a deep dive into your health, lifestyle, and symptoms, aimed at identifying any underlying causes that could be contributing to your nocturia. It's through this evaluation that your healthcare provider can provide appropriate treatment or management strategies tailored to your specific needs. They may recommend lifestyle changes, medication, or even surgical interventions depending on what's causing your symptoms. Remember, your health is important. Don't hesitate to seek help if you're experiencing nocturia. You're not alone, and there are resources and treatments available to help you manage this condition. In the next section, we'll wrap up our comprehensive discussion on nocturia. Stay tuned. Alright folks, that's it for our discussion on nocturia. We sincerely hope you found this information both informative and helpful. It's always our aim to help you understand health matters better. Now, we'd like to ask for your support to continue with this mission. Please subscribe to our channel, Medicine Health 360, to join our community and stay updated with our latest videos. If you found this video helpful, we'd appreciate it if you could give us a thumbs up. Your support encourages us to continue bringing you high-quality, informative videos. We also highly value your thoughts and experiences, so please feel free to share them in the comments section below. Your feedback and experiences can help others who are going through similar health challenges. Remember, we're a community here, and every bit of shared information helps. Thank you for watching, and remember, better health leads to a better life. Let's continue our journey towards better health together. Stay tuned for more informative content, and until next time, take care.